prevention of atherosclerosis, thrombophlebitis, recurring headaches, episodes of dizziness, panic attacks, heart pain, pre-stroke conditions, and blood thinning, with the help of water and regular exercises. Ischemic heart disease and certain pre-stroke conditions can all, in fact, be serious consequences of atherosclerosis. What is atherosclerosis? Atherosclerotic plaques are essentially an excess of cholesterol in a person's blood, which can adhere to the walls of our blood vessels. As a result, over time, this can block the vessel and cause ischemia. That is, ischemia, impaired blood circulation in a particular region, either in the brain or in the heart. Varicose veins, a constant and persistent feeling of heaviness in the legs, and hemorrhoids are all consequences of the thickening and stagnation of venous blood, which in turn can be caused by a condition called thrombophlebitis. So what exactly is thrombophlebitis? As I mentioned earlier, when there is increased blood clotting and stagnation of venous blood in the distal limbs, thrombophlebitis develops. In other words, blood clots begin to form. Blood turns into these clots that also block our blood vessels and further impair the normal flow of blood. And in the worst case scenario, there can even be a thromboembolism when a clot breaks off, travels through the bloodstream, and blocks certain areas of our body. In order to minimize blood thickening, the formation of clots, and to reduce the buildup of cholesterol plaques on the vessel walls, blood not only needs to be thin, but it also needs to be constantly moving as quickly as possible. And this movement can be provided first of all by the heart, which pumps blood through the vessels. And secondly, physical exercise, during which the muscles act as pumps, drawing out and moving the circulating blood, helping the heart to push it through the vessels. The main areas where blood clots and cholesterol plaques develop and accumulate are the cervical region and the peripheral distal limbs, that is specifically the legs and the pelvis, due to our inactive lifestyle. That's why at this point, we will now go through all the levels of the body, starting from the feet and ending with our neck. This set of exercises will help to increase the speed of our blood flow and accordingly help us to minimize the risks of developing these conditions. According to the laws of physics, blood tends to accumulate in the lower limbs, so we will do all the exercises specifically to promote its outflow. So I recommend that you find a flat wall and then lie down on the floor. I'm using a piece of equipment here, but you can also lie on your sofa or your bed if you prefer. Place your legs against the wall with one leg crossed over the other. What's the first exercise we do? Pull your toes toward yourself as much as possible. 1, 2. I'm showing you how to do this, so please repeat after me as we go through the steps together. 3, 4, 5, 6. At this point, I'm pulling my toes toward myself as much as possible, really focusing on feeling the stretch. 7, 8, 9, 10. And now switch to the other leg to repeat the same movement. Same thing. 1, so the outflow is happening right now, and at the same time, simultaneously, I'm working. 2, 3, the muscles are actively pumping and contracting. 5, 6, 7, 8, 9, 10. If the angle is too steep for you, you can always lie a bit lower. Remember, the main thing is that your legs are positioned above your head. For the second exercise, we position ourselves in exactly the same way as before, but now we press forward like on a pedal. 1, stretch your toes. 2, stretch forward. 3, 4, 5, 6, 7, 8, 9, that's enough for this set. Now switch legs. As you do, make sure your other foot is firmly on the ground and your balance feels steady. Get ready to continue. Let's count together. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Remember to keep your movements smooth and controlled and focus on steady breathing. You're doing great. Keep it up. Just now, we worked on both the front and the back of the lower leg. In the second exercise, we'll be working on the front and the back of the thigh. This is a large and important muscle group that can become tight if we either sit for a long time or on the contrary, stand for a long time, or even walk for a long time. Lie down in the same position as before, making sure you are comfortable, because our legs will be above our head for almost the entire session. The starting position is lying down. Gently hold one leg with both of your hands, then slowly lower it down while tensing the leg muscles as much as possible. Bend the back of the thigh, then gradually raise it up, tensing the front of the thigh as well. Straighten the leg completely and be sure to exhale steadily. 1, 2, 1, 2, 4, 1, 2, 5, 1, 2, 6, 1, 2, 7, 1, 2. As I go through these movements, I try to stretch up as much as possible, reaching upward with my arms and lengthening my body each time. This will also help prevent back problems by encouraging good posture and keeping my back healthy. 8, 1, 2, 9, 1, 2, 10, that's enough. Switch legs, do the same thing. 1, bend down, feel the tension. 2, straighten up, feel the stretch, feel the tension here. 3, 4, 5. The sequence is 1, 2, 6, then 1, 2, 7, next 1, 2, 8, after that 1, 2, 9, and finally 1, 2, 8. Each group starts with the numbers 1 and 2, followed by a different number each time. And gently lift your legs up a little bit and then shake them out thoroughly. Basically do a full shake off to help promote outflow from the distal limbs. Now stand up slowly and take a 15-second break, just rest. And if you like, take a sip or two of water to rehydrate. The third exercise will assist in effectively preventing congestion in the pelvic area. And to some extent, it can even help treat male pelvic organ conditions as well as female pelvic organ conditions. The pelvis and also help to prevent the development of hemorrhoids, which are actually varicose veins that occur in the rectum. So make sure not to skip this important exercise and repeat it together with me. The starting position is lying on your stomach. I lie down on my stomach with my toes gently pointing outward. I slowly spread my legs apart and then carefully bring them together as much as possible, squeezing my glutes firmly and making sure to touch my heels together. 1 wide, 2, 1, 2, 3, and 4. Now let your head gently rest down, feeling the surface beneath you. 5 and 6, just place your fist under your forehead, making sure it feels comfortable and supported. 7, so your head can relax, allowing your neck and shoulders to release any tension as you settle into this position. 8 and 9, don't drag your feet on the floor. Try to lift them up just a little as you move, keeping your steps light. Now, 10, 11, and 12. 13, 14, 15, and right here, keep going. Bring your legs together, then bend your knees gently. Spread your feet wide apart, then bring them back together. Squeeze your glutes as you do this. 1, 2, 1. Keep your breathing steady and focus on your form as you continue through the movement. 2, 1, 3, 1. Squeeze your glutes on 4. As you reach 4, focus on tightening your glutes and holding the squeeze for a moment. 1, 5, 1, 6, and 7, and 8, and 9, and 10. Keep your core engaged and your posture upright as you move through each count. 5 more to go. Keep breathing steadily and stay focused. 1, and 2, and 3, and 4, and 5. With each repetition, pay attention to your form and make sure you are activating the right muscles. Stay strong and keep going. You are doing great. Ischemic heart disease, also known as coronary artery disease, is a condition in which heart attacks most often occur due to the blockage of blood vessels by cholesterol plaques. In this video, I'm going to show you a series of simple but effective exercises that will now work the entire region around the heart and accordingly will significantly improve blood circulation so that neither cholesterol nor dangerous clots form in this region. Lie down gently on your stomach on the mat. The exercises will consist of 2 elements. The first element, I place my hands in front of me, my head is down as I exhale like a little boat. I lifted my shoulder blades, lifted my head, and returned to the starting position. This exercise will also work the neck muscles, which means that it will help to prevent cerebral circulation disorders, as well as the buildup of cholesterol in the cervical region of the body. Let me show you again. Head is down, shoulder blades together, gently reaching down with my elbows. Let me remind you, after each exercise, be sure to drink some water. The second element, which we will be using for working and targeting the chest region, will be the following. I carefully and slowly place my hand diagonally and twist onto it. First to one side, gently stretching the chest, then to the other side. 2, 1, 2. These are the kind of rolling movements we're doing. I should feel a gentle stretch across my chest. 2, 5 times. The numbers are 1, 9, and 1. That is the digits 1, 9, and 1 in that order. We're done. Drink some water. And the fifth and final exercise will specifically work the entire neck region. In this exercise, we will gently stretch the front part of the neck and also strengthen the back part. The jugular vein runs along the front part, which drains blood from the head. So if the muscles in the front are tight, they irritate this vein, compress it, and as a result, the drainage worsens, leading to headaches, venous blood stagnation, and so on. How can we prevent this? A simple exercise on all fours. How am I becoming? I pulled back and forward, moving my head back in a wave-like motion, stretching my neck, feeling a stretch in the front part, but on the contrary, feeling tension in the back part. Back and forth. Nine, 10, great. Well, as you can see, during my complex, I used up half a liter of water. That's exactly what I was telling you about. There's nothing difficult about it.